One of the things that I know your group specializes in is minimally invasive procedures to treat neurological issues, yes?
Yes, that is true.
Help me, what is that?
Well, basically, as time has gone by, there are techniques that have evolved that can now allow you to surgically enter the body in ways that don't require large incisions and different corridors that allow you to get into spaces that you couldn't do before. And tools have evolved to allow you to do that sort of thing so that you can accomplish the same goal traditionally that you've traditionally done by large incisions now through very small incisions and accomplish the same effect.
And the benefit of that, I'm imagining, is a lower chance of infection. And what else?
Well, I mean, not only that, but also less post-operative pain from.
Sure. Okay.
Now, the one thing people have to realize is that not every problem can be accomplished through a minimally invasive approach, and sometimes the tried and true method is actually the best approach. So patients come in, saying, "I want this," but you have to sometimes convince those patients that, hey, I think you're better off by having this. So you have to keep an open mind, but if it can be accomplished through a minimally invasive approach, then it should be offered, and we have that ability to offer that to patients. Are
there some problems that respond better? What would make someone a more likely candidate for minimally invasive surgery?
Well, sometimes it has to do with the disease itself. What are you actually trying to accomplish? Sometimes people need fusions, for instance, where a fusion is just to connect two bones together. That's all really a fusion is.
And the purpose for that would be?
Is basically to prevent motion.
Okay.
And when you prevent motion, you prevent the formation of arthritis, and arthritis is really a big factor in causing problems where you get nerve impingements. So if you arrest motion, you basically stop the formation or the body's signal to make arthritis.
Oh.
And I think a lot of people don't realize that, what arthritis is. And it not only applies to the spine, but also applies to other joints in the body like knees and hips. Mm-hmm. So that's why fusions are done. It's a scary word to people. In any event, the reason why we do these things is to arrest mobility such that the actual arthritis signal is arrested. So one way of doing a fusion is actually removing the disc and actually replacing it with a piece of bone or a cage or something that allows the two bones to connect together. So you can do this through a larger incision, or you can do this through a smaller incision in some cases where you can just go directly to the disc.
And that would be preferable for a patient that is suitable for it.
Correct, sure. And that would be preferable. But not every case is like that. But certainly there are cases that can be done that way, and that's oftentimes a very good thing for patients because they can get out of the hospital a lot sooner because they have less pain and therefore can be mobilized much quicker.
Sure. So I guess the trick is finding a doctor that can give you the proper information over which approach to your problem works best, and then is prepared to do the minimally invasive if that's at all possible.
Correct.
Yeah. I understand that there's a nonprofit organization affiliated with the Neurological Surgery PC, NSPC, the Leslie Munzer Neurological Institute. What is that?
What it is, it's basically we decided we wanted to give back to the community at least our experience and knowledge of problems and neurological diseases by establishing this foundation. And what it is it was originally done because this person, Leslie Munzer, she died of something called an arteriovenous malformation, which is a very serious vascular problem of the brain that can cause a bleed into the brain and can cause, obviously, death.
Sure.
So her husband became very interested in finding ways of helping to cure this. And basically, one of my partners, Dr. Jonathan Brisman, became in contact with him and formed a relationship. And they decided to form basically a cooperation. He donated some money to our foundation, and we established it with a mission not only to try to treat or at least understand and help figure out ways of treating these and understanding the disease process of arteriovenous malformations, but also neurological diseases in general. And we've hired a director of that of the foundation, and we're doing events and lectures and ways of basically educating and trying to raise money to basically figure out ways of helping to treat these diseases. For instance, we've offered grants to researchers. We offered money to basically based on application to treat arteriovenous malformations. So we offer grants as well. And lectures and community events.
Well, there's a website for the Leslie Munzer Neurological Institute. If you're interested in more information, getting some of the educational programs perhaps, or helping out with contributions, www.lmni.org is where you can find it. We are nearing, well, we still have a few minutes, but I was wondering, are there any precautions that we can take that help us avoid winding up in your office? No offense, but I always tell my doctors every time I see them, hey, I hope everything is great and that I never have to see you again. So I know a lot of what you're dealing with is unavoidable, but what kind of preventive medicine can we pass along to our listeners? What kind of precautions can we take to try to maintain spinal health, brain health? Help us out.
I think that in general, just having a healthy lifestyle, exercising, trying to avoid certain types of forces that can help promote problems with the spine.
Like what?
Well, for instance, there are as simple as just avoiding shoveling snow if you can. That's one thing that can actually...
Nice work if you can get it.
If you can get it, obviously, but that's one thing that actually is not a good thing for the back. I think basically learning how to pick up objects and things like that, using your legs, and obviously learning how to avoid prolonged periods of sitting and vibration, but sometimes obviously that can't be avoided. But I think that in general, most people who develop problems with the spine, it's sometimes not their fault, and It just happens whether they avoid doing certain things or not.
Is it beneficial? Exercise, I know, is beneficial for most things. Building up the muscles that support the back, your abs, your side. Is that helpful?
Yes. Again, exercise is very important. I think that if you can establish very strong abdominal muscles and what we call the paraspinal or the back muscle by doing exercises that deal with those, I think it can help a lot. But obviously, there's only so much one can do sometimes to avoid these diseases. They're either going to happen or not happen. A lot of it has to do with luck, genetics,
sure. Environment,
and some of them obviously are age factors. People in their 20s and 30s are less apt to be getting some of these diseases that we see than those people who are in their 50s and 60s and 70s.
And then, do we contact you at the first signs of aches, or how do you know when the right time is to get in touch with the neurosurgeon?
I'm happy to see people at any stage, but a lot of patients like to call either their neurologist or their primary care doctors and get a bit of a workup, like getting an MRI if they complain of neck or back or arm or leg pain.
And then get referred along to you.
And then get referred if there's something that is found that appears obviously suspicious or not good, that needs further opinion and evaluation.
Well, terrific. Well, thank you so much for the background. I think we've learned a lot more about the field of neurosurgery, about the program at North Shore LIJ in Plainview, and about Tell me again your acronym. NSPC, Neurological Surgery PC. Our guest this morning has been Dr. William Sonstein of the American Board of Neurosurgery, Board-Certified Diplomate, special interest in complex spine surgery. So he's your guy if you're looking for that. Dr. Sonstein, also the Chief of Neurosurgery at North Shore LIJ Hospital in Plainview.